Well, thank you everyone for joining today. Today I'm going to talk to you a little bit about insurance information for people living with ALS. So I want to first and foremost state that this is only for informational purposes. Insurance is not a one-size-fits-all and may be individualized to you. Please reach out to your care services coordinator or myself for more information and further guidance. But today, I wanted to take some time out and try to have some learning objectives around insurance. So I would like for us to understand the relationships among Medicare, Medicaid, and private insurance. Appreciate the impact of insurance coverage on patient care, coverage of durable medical equipment, home health, and other services, and know what resources exist in the community to assist you with your questions. So I want to start off by stating that we have the ALS Association National Office has created Living with ALS resource guides. They were created because there were a lot of questions around research and clinical management of ALS. These cornerstone educational materials were designed to inform and educate people about ALS in a comprehensive and easily understood format. They address many of the common concerns and issues with people that people face living with ALS. There are 11 of these resource guides. There's actually 2 additional ones as well. We tell folks to not read all 11 or all 12 at once. It could be extremely overwhelming. And I have shared the links to these resource guides at the end of this presentation. But today I'm going to be focusing a lot on information that is in book 4 and book 5. Now, these can actually be downloaded on our website or can be ordered if you would like these in actual print form, or you can contact your care services coordinator and we can actually provide them for you. But a lot of this information that I'm going to be talking to you about is in these 2 booklets, book 4 and book 5, Living with ALS, Planning and Making Decisions, and Understanding Insurance and Benefits when you have ALS. So I want to start off about talking a little bit about Medicare. Medicare is a federal health insurance. Coverage is provided to those who have worked under the Social Security system. So if you've paid into the system all your life, you've seen it come out of your paycheck. This is what we're paying for as we are working. We are paying to ultimately get Medicare. Individuals under the age of 65 who have earned 20 quarters in the last 10 years can receive Medicare and SSDI immediately, thanks to recent legislation that was passed. In addition, unlike other diagnoses, when you get Medicare coverage at the same time as Social Security disability, for years, there was a standard 24-month wait period, even for individuals living with ALS. And it had been reduced to 5 years. For people living with ALS. Thanks to advocacy efforts and the ALS community and the ALS Association, Congress passed a law in December of 2020 that waived the 5-month waiting period altogether. In March of 2021, a follow-up bill made a change retroactive for people who had already applied. This means that you can begin receiving your benefits right away. Now, I say right away, meaning it's a federal organization, so it may take a week or 2 for you to actually get those benefits. Your application will be fast-tracked, so you should know within a few weeks if you qualify. I want to note that this doesn't apply to people diagnosed with PLS. If you paid into Medicare in the past, but not in the past 10 years, you may be eligible for Medicare Part A if you pay a monthly premium. I will go into the different parts of Medicare a little bit further in this presentation. So some things you need to know about your health insurance policy, no matter what type of insurance you have. What is the amount of your annual deductible? How much are you going to have to pay out of pocket before your insurance starts picking up the tab? whether there is an out-of-pocket expense limit and how your coverage changes if you reach that limit. What is your monthly premium? How much will you need to pay just to have insurance? What types of benefits and care will be covered under this rate? With ALS, inquiring about durable medical equipment benefits is especially important. For example, is there an annual maximum on durable medical equipment? And I'll go into that a little bit more. Whether the plan covers ventilators or wheelchairs, things like that. What prescription drug coverage you have, and what exact drug coverage, what exact drugs are covered under that drug coverage. Is it fully comprehensive for you? How much, what is your copay like? How much are you going to have to pay out of pocket to go see a doctor? Do you have an HMO or a PPO? What type of plan is it? HMOs plans are generally less expensive, but you can visit the doctor's plans in network. You also need a referral from your primary care doctor at any time you want to see a specialist. A PPO plan provides greater flexibility, allowing you to see a wider range of specialists without needing a referral. Whether your plan includes home health coverage, including a home health aide. Whether your plan covers hospice care. Are you in network or out of network in some of your doctors? And what is your deductible like? Do I want a higher premium or a higher deductible? Higher deductible plans charge you less upfront, but you will have to pay more for services until the insurance starts helping out. High deductible plans allow you to set up health savings accounts or HSAs, so you can pay your medical expenses with your pre-tax income. So these are a lot of questions that you want to ask while you have insurance. Now, a great tip that I would have for you, so that you don't have to do all of this digging on your own, is to connect with your current insurance plan and ask if they have a case manager. A case manager can really answer all of these questions for you. So if you take the slide that I put here and copy and paste it in an email, or reach out to your insurance plan, ask if you have a case manager, and ask these questions of the case manager, they should be able to tell you all of this information, or at least send you to a place that could get you further information about this. So most insurance companies, if not all insurance companies, do offer case managers. They don't tell you that up front, but it is something that you're entitled to. So I always recommend contacting your insurance company, not only to ask these questions of a case manager, but your case manager can also help advocate for you. If you have a piece of equipment that's not being covered, if you have a really high deductible, if you have a drug that is not being covered that really should be covered, connecting with your case manager, they can do a lot of the legwork for you. So I highly recommend reaching out to your insurance company, usually calling the number on the back of your card and asking them, I'd like to know if I have a case manager and can you put me in touch with them? And they should be able to provide you a lot of information around that. So I want to go a little bit into Social Security, disability, and Medicare. So with disability, we want you to apply if you stopped working or are working a very limited amount of hours if you have sufficient quarters. Social Security, disability, if you're still working, you should limit your work to a low rate of pay, or the Social Security Administration will take deductions from your benefit. So you may, if you're still working 40 hours a week and you want to apply for disability, it's probably not the best idea until you're down to at least part-time. That way you're able to get the disability benefit and then Medicare. Again, as I said before, once you apply for disability with ALS, you automatically get Medicare as long as you've paid into the system for those 40 quarters. And another tip that I have is that if you're unsure of how many quarters that you have, you can actually go to the Social Security website and put in your information, create an account, and it will tell you how many quarters you've worked, how many quarters you still need to earn, and how much your disability payment would be. So you can get all of that information by creating your own account on the Social Security website. If you do wish to continue to work full or part-time, you may want to delay applying for SSDI until you can no longer work or can work less and need Medicare coverage. Currently, right now, the Social Security offices are still closed for in-person visits, but you can certainly still call them and connect with them on the phone or visit their website, which is ssa.gov. And that link will be at the end of this presentation. So a little bit more about Medicare and going a little bit more in depth about Medicare. So coverage under Medicare is similar to what's provided by private insurance companies. It pays a portion or 80% of the cost of medical care. Often deductibles and co-insurance or partial payments of the initial and subsequent costs is about 20%. So you have 80% Medicare picking up, and the individual themselves is required to pay that additional 20%. You can choose original Medicare, so Medicare Part A or Part B, or both. Medicare Advantage plans, Medicare Part C. Part C plans are offered by private companies and are provided similar benefits to government-administered plans. So going a little bit further into Part A through Part D, Part A is for hospital insurance. It helps pay for care in the hospital as an inpatient, skilled nursing facilities, hospice care, and some home health care. This coverage is free if you're receiving Social Security disability insurance. Medicare Part B, or medical insurance, pays for services provided by doctors and other healthcare practitioners, home health services, durable medical equipment, and some hospital outpatient care services. There is a monthly premium for this coverage. It changes every year. I believe currently right now it's about $142 a month. I always recommend, some people have asked me, can I just have Part A and not Part B? Well, there is, I understand that sometimes $142 a month can be difficult to pay. There are actual programs out there that can help offset the cost of that $142 a month. Additionally, if you're receiving Social Security disability, that Part B premium comes directly out of your SSDI check. So you won't even see it. But I do suggest picking up Part B because it does help pay for things that I just talked about. Durable medical equipment is a big one. So I do suggest that, if you're applying for Medicare, that you do have Part A, the free part, and Part B, the part that you have to pay for. In addition to premiums, like I was talking about, Medicare beneficiaries share the cost of the program with the government through deductible and co-payments for these services. So what about Medicare Advantage plans, or Part C and Part D? Well, Medicare beneficiaries have the option to receive their Medicare benefits through private health insurance plans. These private insurance options are authorized by Medicare Part C, which is also called Medicare Advantage, or MA. These are typically managed care plans that require patients to obtain services only from certain providers, may offer reduced premiums, deductibles, and co-insurance payments, and/or additional benefits that are not covered by traditional Medicare, and may also include Part D. Part D is for drugs. So Medicare is the Medicare prescription drug benefit. Part D, if you have Part D currently and you have questions about your prescriptions, there is a great program in Massachusetts called the MCPHS, the Mass College of Pharmacy, Pharmacy Outreach Program. And that information is at the end of this slide as well. But again, the Mass College of Pharmacy is another great resource for you to help with any questions about any kind of prescription drugs. And I want to let you know, outside of this information, next month is starting open enrollment for Medicare. So if you have questions or you need to change plans, you're concerned about what your current coverage is in Medicare and you want to change a plan, open enrollment starts next month. So I highly recommend that, if you're looking into insurance, you're looking to change insurance, you're looking to apply for Medicare, open enrollment is a great time to do that. And I'll go into some supportive services as well. But open enrollment is from the middle of October to the beginning of December, and then you would start that program the beginning of January. So I want to go a little bit into Medigap and Medicare savings programs. If you do not have existing insurance to help cover the out-of-pocket gaps of Medicare, so like I said, that Medicare covers 80% and you're left with the 20%, like co-payments, co-insurance, and deductibles, you may want to consider purchasing a supplemental insurance. Now, I want to put a little caveat around this. I work with a lot of folks, and a lot of folks that I work with don't actually have a Medigap policy. They have other insurances that help supplement. So, but I wanted to give you a full picture of what you could get if you just stayed with Medicare. It's different. Medigap or Medigap policies are different from Part A, B, C, and D. You cannot purchase it unless you have Part A and Part B. There will be an additional monthly premium in addition to the Part B premium for this Medigap program. There are many different plans, and plans can widely vary based from state to state and even region to region. Supplemental insurance is sold by private companies. You can find out whether the supplemental plans are offered in your state by going to medicare.gov and finding those Medigap plans through medicare.gov. If you have limited income and resources, your state may be able to help pay for some or all of your Medicare premiums, deductibles, and coinsurance. So I'm going to talk about this part a little bit later. So it's important to know who pays first. So you, your providers, and other advisors need to know which insurance is primary. Employer insurance, if you're still working, or Medicare. And I will also get into Medicaid as well. Here in Massachusetts, Medicaid is called Mass Health. If you are covered by an employer, the employer insurance from a company that has 100 or more employees, that coverage comes first. So your employer insurance would come first, then Medicare. Whether the employer insurance carried by the person living with ALS or the spouse is also important to know. And Medicaid or Mass Health, and here in Massachusetts, is always the payer of last resort, unless if you just have Medicaid or Mass Health. If you only have that insurance, then of course, Mass Health would be the primary payer. Depending on terms of the employer insurance, it can potentially interfere with the coverage for durable medical equipment or impose large copays. If you qualify for both Medicaid or Mass Health and Medicare, then Medicare will become your primary insurance and Mass Health will become your secondary, covering the remaining 20% of your expenses that Medicare does not. This is why I try to get a lot of folks onto Mass Health, if at all possible. And I'll talk about that in a little bit. But having Medicare and Mass Health, most of my folks end up not having to pay much at all for insurance, because Medicare will pick up the 80% and Mass Health or Medicaid will pick up the remainder 20%. And you're only really left with very small copays to have to pay. Medicaid can also cover some costs that Medicare won't, such as a piece of durable medical equipment. I've had some folks who are on Mass Health or Medicaid who have actually gotten, if they've had a really good case manager, have gotten stair lifts covered by Mass Health. Now, that is a rarity. Not every individual with Mass Health can have those covered. But I do have sometimes people with Mass Health having things that are typically not covered by Medicare be covered by Mass Health. If you or your spouse is still working and you're covered by your employer insurance based on active employment, then your Medicare Part A is secondary to your employer insurance, and you do not need to sign up for Medicare Part B. So again, this is if you or your spouse is still working and covered by employer insurance. So you do not need to sign up for Part B if that is the case. If you are not working anymore, that is something that you do want to sign up for Part B. There are two important things to keep in mind. If the employer insurance is from a company less than 100 employees, then you do need to sign up for Medicare Part B. Medicare then becomes the primary or billed first, and then the employer insurance is secondary and acts to pick up the gaps that Medicare does not cover. Secondly, be sure to check if the employer policy has limits or caps on durable medical equipment. ALS individuals are given prescriptions for a variety of different types of equipment, ranging from AFOs or ankle foot orthotics to cough assist, suction machines, wheelchairs, both manual and power, and Hoyer lifts. Much of this equipment is expensive, and a policy, say for instance, with a limit or a cap of $1,500 a year for durable medical equipment won't be a good standing for you. So we would need additional insurance for that. While the ALS Association Massachusetts Chapter and other ALS organizations can help you find some loaned equipment, if that is an instance where you're not getting pieces of equipment covered, it's not always something that can be counted on. So it's important to check your policy and discuss any limitations with your HR department, but also your care services coordinator. Okay. So why is it important to know which insurance is primary? Well, I kind of talked about this a little bit. If an employer puts a cap on the purchase of durable medical equipment, it may not be able to pick up the balance. Usually Medicaid or Mass Health could. Employer policies may have higher copays than Medicare. Medicare may not pick up the difference. Usually Medicaid can. Individuals want to avoid, this is something that I want to highlight. You want to avoid purchasing manual or transport wheelchairs under Medicare. So if you get a prescription for a manual wheelchair or a transport wheelchair from your neurologist or your physical therapist or occupational therapist, don't have them fill it. Rather, save that benefit for a bigger ticket item like a power wheelchair. The reason why I say that is because Medicare has a rule where if they provide you a transport wheelchair or a manual wheelchair, something that is going to keep you mobile in a way of having that kind of transport, they will only cover one piece of equipment like that, like the transport wheelchair, the manual wheelchair, once every 5 years. So rather than putting your a transport wheelchair or manual wheelchair through insurance, reach out to the ALS Association Massachusetts Chapter or another ALS organization and see if they have something in their loan closet that they can provide you. I would rather have you save that mobility benefit for a bigger ticket item like a power wheelchair, which can cost anywhere between $15,000 to $30,000. I'd rather you save that than have Medicare pay for $125 or $225 transport or manual wheelchair. So if you need assistance in signing up for Medicare, if you have questions about your current Medicare insurance, if you have questions about what's being covered, you don't know if you're having the right coverage, you have questions about your current coverage, or you want to switch coverages, the ALS Association has partnered with the patient advocacy line, and they've created an ALS Medicare resource line. It provides individuals case management assistance for those diagnosed with ALS, helps navigating eligibility and enrollment in disability benefits, and overcoming insurance coverage and financial burdens that impact access to care. So again, like I talked about, signing up for Social Security disability, you have questions about that. This is a great resource line to be able to contact. They have people on staff, not 24 hours a day, but I can't remember what times they function through, but they have dedicated people there who know about ALS, who are skilled in insurance benefits in ALS. And this is a great resource to reach out to. So if you're having trouble reaching out to myself or someone else, another care services coordinator about insurance, this is a great resource line for you to connect with. I highly recommend that you reach out to the ALS Medicare resource line. It's a great resource for you. There are SHIP or SHINE certified counselors. I am a SHINE certified counselor. It depends on the state that you're in. Sometimes they're called SHIP, sometimes they're called SHINE. And they're trained by the State Executive Office of Elder Affairs to be able to assist with questions regarding to Medicare, Social Security, disability, Mass Health, and screen for other programs that you might be eligible for based on your income. And then, of course, your ALS Association Care Services Coordinator is a great person to connect with. If you're really not getting anywhere with these two resources, ShineMA.org is a great resource to go to. We have recently have been doing programs and virtual trainings on how to pick a Medicare plan and what open enrollment means and what does Mass Health mean. So if you go to ShineMA.org, it's another great resource for you, and I highly recommend it. They've changed the website over the past few years, and it is a great resource. So if you need additional benefits and advocacy, if you're being denied benefits, you have questions about, well, why is this happening, or why can't I get disability? Another advocacy unit is to reach out to the Medicare or disability benefits community legal aid. They're usually a free resource for you and have community legal people to be able to reach out to help you navigate some of those issues. So I want to go into a little bit about what isn't covered by health insurance. So there is a lot that is covered by insurance, but I've noticed there are a lot over time of things that aren't covered by insurance. So bathroom equipment, for instance, is not covered by Medicare. I was shocked to hear that because most typically a lot of the falls happen in the bathroom. And for Medicare to not cover bathroom equipment, it's pretty shocking. I don't know why this is. However, you can actually go and pick some of these things up at your local Walgreens or CVS store. But I tell people to don't go out and spend your own money. We have these pieces of durable medical equipment, bathroom equipment in our loan closets that we can provide for you. So if you need a shower chair, if you need an extended tub bench, if you get recommended a sliding swivel transfer bench, those are the things that we can provide for you. So please feel free to reach out to us. Those are the things that we have in our loan closet. We have 8 tools for activities of daily living. So if you have difficulty holding a spoon or a fork or a knife, those are the types of things that we have built up silverware that we can provide for you. That's not covered by insurance. Button hooks, We have, plate guards so that it can help you when you're eating. So things that you utilize on a daily basis for your activities of daily living. If you notice that you're having difficulty with your hands, grabbers, things like that, we have those in our loan closets. The same thing is like the occupational type tools. So if your occupational therapist is recommending a piece of equipment, that is typically not covered by insurance. I've had people who have, when they're sleeping and their hands curl up, and when they wake up in the morning, it's really hard for them to kind of get their hands moving, and it's painful. So we have been able to provide hand splints that have been affected. Those aren't covered by insurance, and they can be about $50 a piece. So those are the things that you can reach out to your local care services coordinator with the ALS Association, and we may be able to provide that for you. Acupuncture and alternative therapies. Some alternative therapies are covered, but it depends on your plan and your state. So some plans may cover acupuncture. I'm seeing that more and more insurances nowadays are starting to work in some of the alternative therapies into their programs. So definitely check with your plan on that, but those things may not be covered by insurance. Home care on an ongoing basis. So home care is a big topic, right, in the world of ALS. A lot of people are looking for people to come in the home and provide assistance. So home care on an ongoing basis is not covered by Medicare. Home care on an ongoing basis is really only covered by Medicaid or Mass Health, and if you have a long-term care insurance policy. Unfortunately, we see so many people in need of in-home care on a continuous basis, and Medicare does not pay for that. It may cover a very limited short-term home health services if there is a skilled need. So I was talking about those activities of daily living: eating, bathing, dressing, feeding yourself, making meals, walking, mobility, showering, things like that. That is a skilled need, and you have to have a skilled need in 2 or 3 areas to be able to qualify for these services. So a VNA, or a visiting nurse, is something that is covered by Medicare. That always has to be recommended by a neurologist, a physician, somebody, a primary care physician, somebody that you're seeing that needs to be recommended by a physician that you're seeing. I always recommend that you ask for physical therapy, occupational therapy, speech therapy if you need it, and a home health aide. What I've found over time is that a home health aide is not brought into the picture unless you ask for it. So you are your best advocate. Definitely ask for a home health aide. Now, these services stay in your home for, again, a limited short amount of time. So it's a great coverage gap for you in the interim while you're looking for home care or other skilled care, but it can be limited. I also want to mention that VNA services, if you're discharged from the VNA, you can always go back on. There are skillful ways of trying to get back onto VNA services. If you've had a decline, if you've had more difficulty with doing something that was different to the care plan that they had created before. I've had people switch VNA companies to be able to get back on service. So there are ways to try to continue your VNA services, even though it's really only short term. Nursing home and long-term care or custodial care is not covered by commercial health insurance plans or Medicare. So if you have an employer insurance, if you have a private plan that you're paying for, if you have Medicare, that's not, if you need to go into a facility, that is not going to, they're not going to cover that facility. It is covered by Medicaid. Medicaid, however, requires that you spend down all of your income and resources to be able to get to a point where you need that type of care. They can, however, accept you into a nursing home. The nursing home will just take those funds. You will be paying privately until you get to that point where Medicaid or Mass Health kicks in. And only Medicaid or Mass Health will provide assistance for bathing, dressing, toileting, feeding, known as ADLs, for a long-term period of time. I'll go into that a little bit more about how people can qualify for Medicaid, even if you think that you can't. There are some ways here in Massachusetts that can help with that. So, Medicaid. Medicaid is a health insurance program primarily for those low-income families and individuals that provides free or low-cost coverage. States may have programs where individuals with disabilities qualify. Here in Massachusetts, we are very lucky to have a program, several programs that do work with people with disabilities. The income guidelines for somebody under 65 years old to qualify for Mass Health Standard, if you are a couple, is less than $2,000 a month. And I don't know how many people can actually survive on that type of income. So that's why here in Massachusetts, we have created, I say we, but I mean the state has created programs for folks who are disabled. And they're basically the way that you would qualify here in Massachusetts is a little different than maybe some other states. There may be other programs in different states that still work with people with disabilities, but may do it in a different fashion. So if you're 60 or under and you're trying to qualify for Medicaid or Mass Health, your income is looked at. So if you are under 133% of the federal poverty level, again, I kind of gave that to you. It's less than $2,000 a month. There's no asset test, but there is an asset test over 65. Not many people fall in that category. So in Massachusetts, there are extraordinary medical expense or medically needed programs, needy programs that are available. One here is called Mass Health Common Health. And Mass Health Common Health is available for people who are working disabled. And I'm using the quotes working disabled because you can actually do it doesn't have to be a job. The qualifications under Common Health is that you have to work for 40 hours a month and earn at least $1 an hour. So I have families who are babysitting, grandchildren, who are I've had somebody babysit a goldfish before. As long as you have somebody who will sign that piece of paper that says that you are doing some type of work and they are paying you at least $1 an hour, you can qualify for this program called Mass Health Common Health. Again, this is for a program for people under 65 who don't meet the income requirements of Mass Health Standard. Now, that program is something that I typically try to get a lot of our folks onto. And the reason being is that if you get Medicare, like I talked about, 80%, and instead of picking up a Medicare Advantage plan or a Medicare savings plan, let's try to see if we can get Mass Health. And if we can get Mass Health, that will pick up the remainder 20%. And Mass Health is going to provide more than what a Medicare Advantage plan can. Again, that provides what's called a personal care attendant, or somebody who's going to be able to take care of your personal needs. Now, this program is a consumer-driven program. Individuals themselves are actually required to hire their own PCAs. There is a PCA directory that you can pull from. There is different types of places that you can find these personal care attendants through, which is something that we can certainly help you try to find. Currently, there is a home care shortage, not just here in Massachusetts, but really everywhere. So it's really hard to find people who are willing to be a personal care attendant. That has been something that has happened since the pandemic, but it is something that we are trying to find more and more people to be able to to be able to become a personal care attendant. There is training for it. What the state does is they provide funding for this person. So you are the employer. You are employing somebody to come and help you. You have a person who fills out a timesheet. You sign that timesheet and they submit it to the state, and the state pays that person for working for you. The state can actually, you have an agency that comes in and evaluates you, and they find out what your current needs are, what you can do and what you can't do. And I tell people to act like it's your worst day and try not to be prideful in that, because they're going to be evaluating you on what you can and can't do. So if you're trying your hardest and you're trying, you're exhausting yourself, you're only going to get that many hours out of them. Whereas if you know that you've had a really bad day and you could really use extra hours, that's really what you wanna focus on, is that remind yourself of how you are on your worst day. And that's really how, when somebody comes to evaluate you, that's really how you want it to be. Now, talking a little bit about that, those hours can always change. So say if an aging and service access point or a local elder services comes out to evaluate you, they come to see what you can and can't do, what your needs are, and they come up with the amount of hours that they think that you may need for care. They then submit that to Mass Health, and Mass Health can either approve or reject that number. If they reject it and give you a different number out of that, you can always contest that. I was recently a part of a court hearing to help somebody get an increase of hours when they had only approved her for an additional 4 hours a day. So we ended up increasing her hours to an additional 10 hours a week out of that court hearing. So there are ways to get an increase of hours. And then again, if you notice a decline or a change in status, you can always have a reevaluation and get those hours changed. There are other programs in Massachusetts that you can utilize as well. I don't believe I have them in this presentation, but I do want to mention that there's something else called the Frail Elder Waiver Program, which is for individuals 62 and older, and meet the requirements of nursing home level care, but are in the community. And so this also additionally provides an additional resource, provides agencies to come and help you in the homes and things like that. So again, that may be a resource that we can connect you with as well. So again, I know this is a lot of information, but please feel free to connect with your care services coordinator, and we can kind of further guide you on what may or may not be the best program for you. So a lot of people, oops, my slides are out of order. So what about, a lot of people ask me about short-term and long-term disability. So if you're still working and you've purchased a policy prior to your symptoms, or your employer automatically enrolls you. So we here at the association are as employees are automatically enrolled in short-term and long-term disability. So if you have a program, actually the state of Massachusetts has a new program that was just started this year called Family Medical Leave and Paid Medical Leave. Now the state also can additionally help pay for some services for you as well. If you're unable to work, you should talk with your HR department or insurance agent for details about your benefits. That's really the first and foremost thing. They should be able to provide you with a couple of pages about your short-term and long-term disability insurance. That's something that we can certainly sit down and talk a little bit more about. If you have private long-term disability insurance, and qualify for SSDI, your long-term disability benefits policy may be reduced based on the terms of your policy. They don't want to double dip. So if you have a long-term disability insurance and are receiving SSDI, you may have one of them reduced. But you should be able to receive the benefits according to your policy contract. You'll receive a monthly check that you can spend on anything. There's no requirement on what you spend it on. The more you paid in premiums, the greater your reimbursement should be. And again, you can talk to your HR a little bit more about what the payout would be. Short-term policies can last from a few months to a few years. Long-term policies can pay out for many years or even up to a specified age. It all depends on your personal insurance that you have in your company. Most plans include an elimination period, which is the time between when you stopped working and begin receiving benefits. Benefits usually begin when your sick leave time has been used. So a lot of companies require you to utilize all of your paid time off, all of your sick leave, before you can start accessing short-term or long-term disability benefits. So what other programs may exist to kind of help you figure all of this out? So there is a program, if you're under 65, there's a program called Options Counseling. It's a program that exists at ASAPs, or Aging Service Access Points, and Centers for Independent Living, or CILs. You can actually Google Options Counseling, and I think it's called Mass Options here in Massachusetts. And this is really created to help patients and families learn what their choices are and kind of point them in the right direction. I send a lot of people to Options Counseling, especially for housing questions. So I know that that's a little bit outside of insurance, but Options Counseling does a lot more than just insurance. They help people with advocacy. They help people with housing issues. They help people find grants. So an options counselor may be, and again, here in Massachusetts, it's called Mass Options. Or the National Council on Aging also sponsors a website called the Benefits Checkup, which is a great resource. I recently used it, and it's a user-friendly tool, which allows individuals to search for possible assistance based on income, demographics, and personal medical situation. You can even put in your zip code in there, and it will tell you where you can get those services. So really easy to remember, benefitscheckup.org. And your local elder services program. So I tell people oftentimes to reach out to their local elder services. If you Google elder services in whatever town you're in, so elder services of Worcester would pop up, and there's a couple in Worcester, but they are another great resource to kind of pinpoint you to certain agencies that might be helpful in finding home care, in finding maybe meals delivered to your home, maybe finding a home health aide, finding out what types of insurance may be available to you. So they're a great program that are often underutilized. So I highly recommend reaching out to your local elder services as well. And they may actually hook you up with a Shine counselor if you're looking to talk with insurance about. If you are a veteran, thanks to advocacy efforts of the Veterans with ALS, the ALS Association, and key members of Congress and the Department of Veterans Affairs, ALS has been listed as a service-connected disease. This is 100% service-connected. The final regulation provides that any veteran who is diagnosed with ALS, regardless of when or where they served, who has at least 90 days of continuous active service in the U.S. military, they do not have to be, shipped out, but they have to have 90 continuous days of active duty, may be entitled to VA benefits. There's a ton of benefits, and this is just a very quick snapshot of the benefits that are entitled to veterans. And veterans are twice as likely to be diagnosed with ALS. So this is really why this became a huge proponent, because We are unsure of why that is, that veterans are 2 to 3 times as likely to be diagnosed with ALS, but we thought that it was really important for these veterans to be 100% service connected. So benefits may include disability compensation, adapted housing grants, grants for accessible transportation, insurance and benefits for dependents, survivor benefits, aid and attendance allowance to provide in-home care, and a whole lot more. You can learn more at our ALS.org website, Navigating ALS and Military Veterans. But I highly recommend, if you are a veteran, and it doesn't matter if you're in Massachusetts, it can be anywhere in the US, the Paralyzed Veterans of America is an incredible nonprofit organization that helps veterans actually get enrolled in these benefits. And they're a wonderful organization. There's a great office here in Boston that we work with on a lot of our veterans. So the PVA, or the Paralyzed Veterans of America, is another great resource for you to reach out to. Are you still not sure? Not sure where to go, not sure what to do, not sure what to sign up for, not sure about your finances or how some of your assets may work with Medicaid or Mass Health. I highly recommend connecting with an elder law attorney or a financial planner. Now, I do know that sometimes this a cost is incurred with this. You can write it off in your taxes because it is a medical necessity. And you may be able to get a grant if there is a grant through an ALS organization to be able to help pay for some of these attorney fees. But if you have assets and you're really unsure about where to go, you don't know if you want to put all your eggs in one basket. Elder law attorneys are a legal practice that specialize on issues and affecting the aging population. The purpose of elder law is planning to prepare the elderly person or disabled person for financial freedom and autonomy through proper financial planning and long-term care options. So if you're still unsure, you have assets, you're not sure what road to go down, connecting with if you have a financial planner, reach out to that financial planner and talk with them a little bit about this. See if maybe they do a little pro bono work for you. We do have some resources here in Massachusetts that we'd be happy to share with you for some elder law attorneys. I have had some luck with getting some pro bono work, but it's not always the case. So getting at least an hour of education around what you can and can't do, the money that you may need to move around, things like that. And I say move around, but move around in a safe way so that you're transferring assets to your spouse and maybe not transferring assets to a son or daughter, because there may be a 5-year look back period. So things like that you kind of want to be careful of it and pay attention to. So if you have questions about some of your assets and you're really not sure about it, definitely connect with an elder law attorney or a financial planner. The National Care Planning Council promotes and supports planning for long-term care as well. Their longtermcarelink.net will direct you to sites we believe are useful information, elder care and elder law resources. So again, longtermcarelink.net is another great resource. And I recommend that you look into your finances and try to plan for the future. ALS is an incredibly expensive disease. There have been studies that are a little outdated at this point because I think the cost of living and the cost of everything has increased over time. That there was a study done several years ago, I believe it was maybe 6 or 7 years ago, that stated that it costs about $250,000 a year to live with ALS. Now, that is what you pay out of pocket, what insurance pays for, the pieces of durable medical equipment that you may or may not need. And so that's why it's really important to kind of think about insurance and what type of insurance is really going to benefit you in the long run. You may not need some of these services now, but these things take time. You do get automatically qualified for Medicare and Social Security disability if you've paid into the system for enough quarters. But going through the state process of Mass Health may take some time. So I often advise people to start thinking about this sooner rather than later. And that's something that we can certainly work with you on as well. So I wanted to provide you with some helpful resources, and if any of you attending today would like to see these slides, I'm happy to send them to you as well. But we are recording this, so I can certainly share this when we are done recording. But some helpful insurance information. This first YouTube video, I'm sorry the link is not actually there, but that is, if you go to what I was talking about, shinema.org, this YouTube video is on there. So Introduction to Social Security and Medicare, the basics. This is one of that book. Actually, this is an FYI, Medicare information from our ALS Association.org website. Medicaid.gov, Medicaid and you, gives you certain information about this particular state that you're in, and what types of Medicaid programs are out there that are available to you. If you're looking to apply for disability, go to ssa.gov. That is a great resource, and I highly recommend that if you haven't applied for disability yet, you absolutely should. If you're a veteran, the association puts out some helpful information for military veterans with ALS. If insurance isn't enough coverage for medication, so if I've had this situation happen before where somebody is taking Radicava, and with the infusion, and they're having it done in home, and the cost is just too much. I've sent people to the HealthWell Foundation, and the HealthWell Foundation is an organization who helps assists with medication coverage. I believe it's up to $15,000. So that's something that you may, if you have an expensive drug that is, and I have to stress, that's approved by the FDA, because they won't help with anything that's not approved by the FDA. That's approved by the FDA. That is something that you should go to the HealthWell Foundation if your insurance is not covering the drug completely. I've had people with Nudexta having an exorbitant amount of money that they have to pay a month for Nudexta. So I recommend going to the HealthWell Foundation. They do work with people with ALS. Like I talked about in the beginning, Living with ALS resource guides. I showed you book 4 and book 5 right here. These are found right here on our website, on our national website. There's 11 of them, and they're great. They're separated out by topics. You can either download them, or you can ask us for a copy, or you can order your own copy as well. So that's something that I highly recommend. They're written at a level that people can understand. And they're really helpful and give you some great tips and tricks. And then here, this last one, I wanted to include an individual that we work with, living with ALS, wrote an article. He owned his own company, and he was trying to figure out how to talk to his employees about his diagnosis and disclosing his diagnosis within the workplace. So if you're still working, this is a great scholarly article. It's written from a patient's perspective about disclosing disability in the workplace. So that concludes my presentation today. I hope that you all enjoyed it. I'm going to take questions now, and I'm happy to stop sharing my screen so that you all can so I can see you and we can connect.